on the road, in the gym, at a coffee house. No matter where you listen, this is Prevention Perk. I'm Steve Miller with Mid-America PTTC. It's time to perk up our prevention efforts. My guest today is Julie Stevens, who has dedicated her career to prevention across the lifespan and the treatment of substance use disorders. Along the way, she served in various leadership capacities, including her current term on the board of International Certification and Reciprocity Consortium. She also serves on the Texas Certification Board of Addiction Professionals. Since 2013, Julie and her partner Mitchell Moore have operated the nonprofit Prevention Training Services, reaching an international audience with virtual trainings and conferences. Hello, Julie Stevens. Welcome to Prevention Perk.
Well, thank you for having me. I'm happy to be here.
Well, I've been excited about this conversation since I saw a presentation that you did last year. I believe it might have been at NPR, and you talked about prevention for the boomers. And we were talking before we got on here, not about those boomers in Oklahoma, but the boomers by age. And I thought, let's have a conversation with Julie Stevens about prevention across the lifespan and talk a little bit about prevention for an older demographic. And before we get into that, talk a little bit about your path to prevention. How'd you get into this line of work?
Well, sort of inadvertently, I lived in Huntsville, Texas, which is the home of the prison system in Huntsville, and had a degree in psychology and went to work in the prison as a case manager in the psychiatric unit. Yeah, and got then I transferred to the alcohol and drug unit, and that was my real first exposure. And I worked with the counselors that did counseling in the various units in the prison system. Then I went to work. And at that time, I got my license as a chemical dependency counselor. And that's been a long time ago, like in the 80s, late 80s, let me just say. Then I went to work for an agency in Fort Worth and was promoted to director of education. And that launched me into the education field, the prevention field, the training field. And I really just loved it. And so I stayed, I quit my counseling job and stayed in the training, technical assistance, and prevention field. I went to work for University of Oklahoma because even though I lived in Texas, the university had a grant from the Department of Education, the Safe and Drug-Free Schools grant, and it was the Southwest Regional Center for Safe and Drug-Free Schools, and they covered 10 states. So I was the liaison for Texas. It was great because my boss was 250 miles away, so I could just do what I needed to do in Texas. But I also worked in the other states because we worked together. Several of the liaisons did. And when that grant from the Department of Education lapsed, the University of Oklahoma created their Southwest Prevention Center. And so they kept going even though they didn't have the federal grant. Meanwhile, here in Texas, I became director of prevention for the state of Texas. And we put in prevention resource centers around the state. We funded community coalitions around the state at that time. And eventually, SAMHSA funded the CAPS, Centers for the Application of Prevention Technology, and one was the University of Oklahoma. So I went back to work for the University of Oklahoma and was there, total of 14 years working and doing SAPS trainings and ethics trainings and all of those very crucial and interesting trainings to make the prevention field actually more competent. That's kind of what I'm working toward, is that those people who want to work in prevention have the tools that they need to do the work.
You told me before we got on here, I said, are you ever planning on retiring? And you said, well, I have twice. So I'm glad that you keep coming back because you're providing a valuable resource, especially when you start talking about making sure that we have a competent workforce that's ensuring that we have a future of prevention. I'm kind of curious though, because you've listed a number of things. You were a counselor and worked in the prison system, case management, prevention. What are some of your, I don't know, some of the projects that were your favorites that you got to work on through your career?
Well, actually, the training is, because not only does it put me in touch, I travel all over the United States, and I've been to Bermuda 6 times doing training. Isn't that too bad? Getting my way
Especially this
to,
time of year, what a great place
yeah,
to go.
yeah, that'd be great to do training for the country of Bermuda. And so I really love the training piece because I met a whole lot of people. Um, and when we talk about retirement, one day I really truly will retire. And when I do, I want to leave this work in the hands of competent people. I am on the Texas Certification Board of Addiction Professionals since 2006. Once the board had met me somewhere, and they realized that they didn't have a prevention specialist on their board. And so they recruited me to run for board, and I got elected and became chairman of the prevention committee for Texas. And then made me a delegate. They took me to ICNRC, the International Certification and Reciprocity Consortium, where at that time we just had delegates, and the person who was the chair of the prevention committee at ICNRC had stepped down, and they recruited me to be chair of that prevention committee, which I've done since 2006.
You mentioned that you like the training, and at least at this stage in your career, or careers, I guess I should say. And I mentioned in the intro that you have a partner. We've talked to Mitchell Moore before on the podcast, but you guys have the prevention training services, and that's really what you're dedicated to, is really trying to align things with the ICNRC certification, so that we can get the prevention field moving in a direction where they have that accreditation, which really shows that they've studied hard to get that accreditation. So is that really what your efforts are now, is through prevention training service to really help build
Yeah.
the workforce of tomorrow?
Yes, absolutely. Mitch and I and another gentleman named Dr. Robert Landry started prevention training services in 2013, and we actually developed a curriculum that we called Fundamentals of Prevention. Didn't do a whole lot of training on that, but we did do a little bit of prevention training, and had the opportunity in Texas whenever our Texas state single state agency funds prevention training, because they require, the Texas Department of Health and Human Services require that program directors who receive their funds, their block grant money, must be certified prevention specialists. And so because they require it, they have to furnish the training. And so they did that. And then at one point there was a lapse in that training. And so Mitch and I jumped in and began doing training around the state. And it's directly related to the domains that are required of the certified prevention specialist credential. There are 6 domains. And the other thing I've done with ICNRC is helped create the standards and the exam for the credential. And so, there are questions around each domain. And so we do training, Mitch and I, and prevention training services around those domains, so that people will be equipped to pass the exam and have the knowledge that they need and be competent in delivering prevention services.
You're listening to Prevention Perk. The funder of this project, along with all the other products of the Mid-America PTTC, is the Substance Abuse and Mental Health Services Administration. Although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Get Connected, a free downloadable resource, helps understand the issues associated with substance misuse and mental illness in older adults. The toolkit also contains materials to educate older adults. primarily prevention focuses on the adolescent experience, trying to prevent the early onset of substance use and then further, complications from substance use disorder on down the line. But one of the things that seems to be, at least from my perspective, is lacking is the prevention amongst the older adults. And so when I saw your presentation around the boomers, I thought, well, this is a great conversation, and I'd like to kind of launch into that a little bit.
Certainly, I've been executive director of a couple of agencies. And we had funding for prenatal, for those at-risk mothers and pregnant women and teenagers. And then there's been funding for like Head Start up to age 3 years old, and funding for kids. And I mean, when I started in this field, the funding started about with children, maybe in kindergarten and on up, and then went through adolescence. And then it expanded to older kids, older adolescents, and then young adults up to college age. And so in the first place, prevention gets less funding than treatment does. It's like 20% of the block grant. And so there's little money for prevention anyway. And so the money that is out there is focused on the younger populations. Well, I'm an adjunct professor at University of Oklahoma for the Masters of Prevention Science program. And one of the courses that I teach is prevention across the lifespan. Now, this is a college course, this is like 45 hours total. So my mentor actually took that information and developed a 3-hour workshop on prevention across the lifespan, which I inherited from him. So in that 3-hour workshop, we look at developmental stages, human development, and transitions. Well, Erickson goes way the heck up. And in fact, he has a 9th stage now. I don't know if you know, but he had 8 stages, and now there's another book, a ninth stage, and that's for people who are in their 80s who are looking back on their life and looking back on the stages that they've been through and seeing how satisfied they were and if they accomplished everything. And so we rarely look at anything past what his stages are, past young adulthood. And there are definitely risk and protective factors in middle age and different risk factors. In fact, people of middle age have things that they are looking at, like families, like finances, like life choices in terms of the jobs that they do, that younger people don't have those. Hawkins and Catalano didn't identify those risk factors in their early studies. And so, and then there are protective factors around those as well. And so, that's what I look at. And I look at ageism also. I have a workshop on ageism and how people view older adults. Used to be they were the elders, the mentors. And then when the printing press was developed, instead of going to your elders for information, you read books. You began to read books about it. And also the industrial age is one thing that's changed how we view adults. We don't stay together as families. We go where the jobs are. And so, very often adults are neglected. Older adults are neglected, and they absolutely have issues and risk factors that sort of predispose them to having issues with drugs and alcohol.
So how does that messaging change? I mean, how do you appeal to an audience that's spent their whole life maybe raising kids or grandkids hearing about just say no and those kinds of things? How do you change the tone of that for an older population?
Well, you have to provide the resources for that older population. And I can tell you my experience. I live in a retirement community, and people who live here, and there's a lot to do. Oh my gosh, there's tennis courts, there's golf courses, there, swimming pools and computer clubs and quilt clubs. There's a whole lot to do out here. And but if you look at the population, I can tell you one experience that I've had. There's one neighborhood that has what they call Beer 30, and Beer 30 is somebody will decide it's a beautiful day. I want to have everybody over to my patio and so they blow an air horn. Okay. And this air horn is the signal to the neighborhood. Come to my house, bring your beer, bring your wine, bring your pretzels, bring your peanuts, and let's sit around and visit, And sometimes what they visit about is their aches and pains. Oh, I have a pill you need. I'll give you my prescription opioid for that pain. The other thing is, let me talk about baby boomers. Remember in the 60s, when you're not a baby boomer, but I am, people used to smoke pot. Well, it was very, let's just say mild compared to what it is today. And so, it might be that this population has decided, I remember I used to smoke pot when I was in the 60s. I quit because I got a family, I got a job, I had to raise a family. So for 40 years, I didn't. But now I don't have those things, to hold me down, hold me back. So I can smoke pot now. I have a friend who was an assistant district attorney here in this county, and he said to me, because he knew I lived out here, he said, "Julie, I hear there's pot parties going on in your retirement community. Have you seen any?" And I said, "No, do you need me to go undercover?" And he said, "No, don't do that." But I saw a lady with a t-shirt that said, "Pot, it does a body good, just say maybe." And so there's a change of attitude, and plus with medical marijuana available, about it. So that's another risk factor that we're looking at, not only sharing prescription drugs or adding alcohol to prescription drugs, but also, beginning to smoke the marijuana again, the cannabis again. So definite risk factors for this age group.
So do you see, I mean, like I said, I saw your presentation. Do you see other growing interest in this, other prevention specialists or, entities that are developing some curriculum around addressing an older population?
Well, the only one I know of is SAMHSA. They have a curriculum called Get Connected that you can get from their website, I think. But that's all I've seen. I have not seen a lot of funding to look at the issue of risk and protective factors, to study that. We have made assumptions, and we have made leaps from our adolescent risk and protective factor studies to adults, middle age and older adults, and made, a certain assumptions about it, but I have not seen a whole lot of research about it. Now I've seen one, and in my presentation, I do talk about some of the risk factors that people have, and then also some protective factors about, access to resources, access to medical services. And access can mean not only geographic, like if you live in a rural area and you need to see a doctor and he's 30 miles away. It can also mean things like insurance and money, and finances is an access issue. So, but we do know of some protective factors for this age group, and as well as health education and personal development and sufficiency, those kinds of things, relationships, attention from family, those kinds of things. But there's not a whole lot of, number one, there's not a whole lot of research, and number two, there's not a whole lot of funding that is directly, other than, I guess, I also look at media, and other than some social media, there might be some environmental strategies out there that we can look at for older adults, and some messages, media messages, but
It always seems to come down to that the funding word, whether it's there or not. But there isn't there. I'm assuming from your experience there is a need for it. What do we do to maybe start to look at ways to elevate the awareness for the need, or advocate for support services for an older population? What do you think would be necessary to kind of scratch where it itches?
Yeah, and that's what it's going to take is funding and advocacy, like you mentioned, because and what I'm hoping is that as our legislators age, and they're still up there in Washington, or they're, at the Capitol, state capitals, that they actually personally do see the issues and the need to look at. Because here's what's happening. First of all, we're living longer, right? We're living longer. And we're having healthcare issues, and prevention is effective. And so if we spend the dollars on prevention, then we save the money in the medical costs and the insurance costs and all on the end of it. And so, that's my message always has been, is that prevention is effective. It's every dollar spent in prevention saves what, $10 in healthcare costs or treatment costs and insurance costs, maybe even criminal justice costs, those kinds of things. And so it just makes sense. The problem is I cannot tell my legislator, if you fund me for 3 years, at the end of 3 years, I'm going to save, 1,000 lives. But, if you fund treatment, you can say, okay, this many people went through treatment and they're still sober after 18 months or 3 years or whatever. But you can't do that really. So we have to make the leap, like I said, with risk and protective factors. If we put in some of these protective factors, then it's going to pay off in the long run. And so, beyond funding, we need to have things like policies in place, social determinants in place, and that's another whole topic, is social determinants of health and mental health, and opportunities and resources in our communities.
That's why I wonder how prevalent this really is, and if it really is either has presented itself or is presenting itself as an actual problem in society today. And I'm sure we could point to things like you've already mentioned. Legalization of marijuana is happening in a lot of different states across the country. The boomers are retiring, and maybe they're revisiting their yesteryears. Alcohol's always been around, and then of course we have an opioid epidemic, and I would suppose that the same thing holds true whether you're 16 or 66. Prevention's prevention. I think that what's lacking is the awareness that it needs to happen across the lifespan, and it just needs to look a little bit differently. The way I would talk to a 16-year-old is going to be different than the way I would talk to somebody that's a older demographic.
Absolutely. And we know that prescription medicine that has increased like 150%, and the opioid problem has caused a lot of people, in this demographic, to have issues, especially when they combine what they think, and the prescription drugs with alcohol, because alcohol is number one issue for this group. But do the physicians understand, and do they even ask the question? Do they even, I'm going to give you this opioid, and how many glasses of wine do you drink a day? They don't ask that question. And sometimes the pharmacist could also put the warnings there as well. So I think it's some of it. We need to look at the data, because the data that I've seen does show a large increase in admissions of older, and suicides also is another issue, but admissions for prescription drugs and alcohol to treatment for older adults as well. So it's definitely, there needs to be awareness, there needs to be prevention, there needs to be family members who are aware, who also kind of watch over what people are doing and using, and provide that care and those financial resources and those access resources to older people, so that they can have what they need in terms of prevention, before they need to treat.
Oh, definitely. I mean, that's where you already said, for every dollar spent on prevention, there's there's a payoff. It's just harder to see that you've prevented something from ever happening, and addiction can happen across the lifespan, and therefore prevention is necessary across the lifespan. I'm curious, you talked about getting connected. Do you know of other resources that are available that the audience might need to know about at this point?
I would go to your agency on aging in your community. That's one that might have some resources. Uh, but the state government and the federal government, the SAMHSA, has resources, but we need more. We certainly
Well, we'll put a link
we
in the
need
show
more.
notes to the SAMHSA resources, the Getting Connected. I think they have a whole website dedicated to prevention for an older audience. And I think there's new innovations coming all the time. You're listening to Prevention Perk. SAMHSA has a number of products for serving older adults with mental and substance use disorders that can be useful to clinicians, other service providers, older adults, and caregivers. Look for their section on new items from SAMHSA for professionals serving older adults. It's now available at samhsa.gov/resources serving older adults. Before we get away, I want to give you the opportunity to share your sage wisdom with us, Julie Stevens. Is there something that we haven't talked about that you would like the audience to walk away with?
Well, what I hope that the audience realizes is that they're going to be there someday. It's going to be me someday. And, if it's not your parents or your grandparents now, you certainly would want to be aware of the issues and provide supportive family relationships, provide health education, be aware of some signs. For example, Wernicke-Korsakoff syndrome, which is wet brain, can have symptoms like long-term memory loss, short-term memory loss, confabulation. So kind of be aware of those types of issues and look for those, and be supportive and provide resources. If you have family members that are you think might have, and make the doctors aware, make physicians aware of the issues. So and the other thing is, yes, advocate and advocate for funding and for legislation, and for policies that are going to be supportive of treatment issues and prevention issues for across the lifespan. I mean, if we could, go prenatal and cure it all, when kids' brains are developing, then that would be great. But absolutely be an advocate and supportive of prevention issues across the lifespan.
Well, it is an important topic, and I appreciate you taking the time out of your busy schedule in your ongoing unretirement. I'm glad that you were able to join us today and share a little bit with us about this topic. And we will encourage the audience to see the show notes and to learn more about the resources that are available and talk about prevention for older adults in the communities that they serve. Thanks for being here today, Julie.
Well, thank you so much for having me and letting me talk about this very important topic. Appreciate it.
And thank you for listening to Prevention Perk, a podcast from Mid-America PTTC. To learn more about our innovations, visit pttcnetwork.org and look under your PTTC for the Mid-America link. Remember, prevention is better together, and together we are stronger.